Hi, this is Tracey with LLCTracey.com, and I'm here back in Vigo County, Indiana, where a year ago we did a documentary on this medical model, which are employee health centers called wellness centers here in Indiana. And we spoke with some people last year when we were here, and we're back here to get an update. One of the persons that we spoke with last year and interviewed was Jennifer Bowling, and she's here today. And of course Christie Lee, who's the president of Advocating Health, and she's here today. And we have Mick Newport, who since I interviewed last year has taken over John Orr's place as HR director. And so we're happy to have him here today to get his perspective. We hope that by the end of this interview, our goal is to really have an idea of the progress being made. And to be quite honest, we're here to find out if this is a model for other people. So as we dive into the questions, we hope to educate you viewers on this medical model that's actually bending the cost of healthcare downwards in a time when healthcare costs are rising at a rapid rate. Today, our goal will be to present to you the Wellness for Life and talk about these facilities that are growing all throughout Indiana and probably soon other places. But this is the birthplace of the model, Wellness for Life, which is redefining healthcare in Indiana and probably across America. I've done some research on this model over the past year and a half or so, and that's why I came to Indiana in the first place a year ago and met these folks, because out of all the models that I looked at, I saw that this was really having the biggest impact on A, quality of care for people, B, which is more important to the taxpayers who are paying for this system, that it's actually a great investment in their employees and productivity, but also in utilizing and being good stewards of taxpayer dollars, because it's actually saving money, and that means savings to the taxpayers. So that was the interest that I came for, and so we're here a year later to talk about Wellness for Life and the impact it's had on you personally and on the system that you actually manage. So I'll start with Christie. And Christie, tell us a little bit about the background of the company, and then how you built a relationship with Vigo County School Corporation.
Absolutely. About 3 years, probably 4 years ago now, Dr. Patel had a vision, and literally Dr. Patel, myself, and a couple of other individuals of our team, we sat down at a table, and we just started discussing our own personal frustrations with healthcare, with taking either, I'm in charge of my mom's primary care, and even taking your children or yourself to the physician's office, the long waits, 2 weeks to get in, 2 hours when you get there, running around town to get your prescription, those kinds of frustrations. So what we decided to do, because we, like you, did our research into the other, and at that time, on-site clinics, that was the buzzword. That's what everybody was, moving towards. So we did our research. We looked at all the models, and even looking into those models, we said, okay, what can we do that adds that extra 10%? And we're a company built on that foundation. We truly believe that when you give 100%, people applaud you and say, great job, this is wonderful. But when you give 110% and you take that last 10% and you make that last 10% that human component that sometimes is removed from healthcare, which is unfortunate, because in order to truly impact a patient's life, you have to build a relationship. That human component has to be there. And so we decided that the Vigo County School Corporation, Dr. Patel, approached Danny Tanous, who is the superintendent, with this vision, giving him the dreams, literally talking about a dream. And Danny, who very much values his employees to an absolute enormous, there are times when we've had Danny come and speak to our staff, and he moves our staff to tears. He truly has a heart for the people that encompass his school corporation. So in talking with him, the dream that we were sharing, that Dr. Patel shared with Danny, he was all about it. How do we make this happen? And then that's where Jennifer Bowling and John Orr came into the picture at that time to dive into that and do their research and their due diligence. And from there, they of course approached their broker with the idea. And long story short, here we are today, 3 years later. But truly it began with a vision and a dream of what we as a company felt we wanted our children or our parents or ourselves to receive in healthcare. How can we give that to others? And that's truly what we've done. It's amazing because when I look back 3 years ago, the model was very simple. It seemed very simple. You know, you literally, I would say we have a 98% rate where patients are seen the same day. When they come here, they very rarely wait over 5 minutes unless it's an emergent situation and, you know, we're tied up and they understand that. And then from there, if it's, you know, some of the, you know, antibiotics and maintenance medications we have on house, so they literally can come here. It's a one-stop shop. They can come here, be seen, get their medications, and go home. And even from there, it evolved into more and more and more because we got to know our patients so well that we didn't want to let go of them. So, like, then all of a sudden, they were able to get a hold of their provider anytime and 24 hours a day, and they had personal cell phone numbers to text if they had issues. And then that allowed us to prevent unnecessary ER visits or unnecessary, you know, even hospitalizations, because we can actually come and monitor and see the patient every day without it costing any of the system. And so literally it began as a vision and a dream that at that time, Danny Tanous and John and Jennifer took to the school board and the steering committee of the Vigo County School Corporation and made it reality. And then Mick Newport in the last year has came in as just a very strong advocate to keep this program alive and very much successful.
Great. Can you introduce our
Sure
guest now?
This is Jennifer Bowling. She's the benefits manager for the Vigo County School Corporation, and Mick Newport is the HR director for the Vigo County School Corporation.
Great. Jennifer, we sat down a year ago, and we just, you and John at the time shared pretty much the same vision that Christie just shared with us. In that year, because now you have 3 years of, when's the anniversary?
It was in September.
September, so it is
21st,
exactly
around
3
there.
years this month that this all started. Can you tell us from a benefits manager perspective what other benefits managers what it was that you saw that said, yeah, we got to do this, and then kind of tell us whether or not it fulfilled everything you expected, or you know, or not. So
I know the term's overused, win-win, but this is, as a benefits manager, the one thing I can truly say that is a win-win. The corporation saves money, the employees save money, we get people healthy, we keep people productive at work, and so from that perspective, it has done everything and then some. Over the last year, I think it amazes me just when I think that we've delivered the service that can be delivered. You know, we're at the top of what can be done, that Dr. Patel, Ken, the staff of Wellness for Life, they go over and above what I think they can do. I'll have a patient of theirs who's an employee call and save, you know, they just saved my spouse's life. They came in for a physical, but they started talking about things that weren't quite right, and the next thing they know, Dr. Patel's like, we're not going to talk about the physical anymore that you need for this position. We're going to start getting you some tests run. And ended up, he had blockages, and that saved his life. So constantly, that type of information is coming across our desk. And that is the good news that we like to hear.
So that's not just the exception, you're hearing that from a lot of people?
We are hearing that from a lot of people. We've had, you know, situations where people now have the expectation, though. The bar has been set high, and the expectation is, I'm not going to wait. You know, they are going to see me the same day. And, you know, they're a little spoiled. And that's probably the one thing that we don't have. I think I've had 5 complaints that we've really had to look into. Everything else has just been that I had to wait a day or something before they could get in, which is a rare thing.
So, Jennifer, what you're saying is the experience is there's been an expectation now built because the reputation has been of quality care that now people have. In 3 years, it's changed from a system that they might have been in the normal system, and now they're in almost like a specialty of I'm an important person and I expect to get in and I expect to have that care right away and not wait. It sounds like the perfect scenario. So now it's 99% is not good enough. They want 100%, which is a great thing. It keeps. Would you agree? It keeps you and your employees always on their toes.
It does.
To keep that height of care up.
And it does, and truly, I feel like our community as a whole in healthcare, they deliver 100%. But what these individuals, what our patients here get is 110%. It's that over and beyond what you normally would expect when you go to the primary care physician's office. And the really cool thing about this school system, initially before we even opened, and especially the first month that we were open, we went out to all the employee groups. And we literally shared with them, marketed it in a way that we said, this is your clinic. This is all about you. Danny, Jennifer, the HR department, they want everything that we do to be about you. So now what we find here is this is literally a home for them. They don't come in here with a reservation of much of anything. And you're right, they're very territorial. It's really, and you know, when I do the recruiting and I hire providers, and actually when I sat down and talked to Ken a while back, a year or two ago, you know, I said the cool thing about this clinic is a lot of times, like teachers, you give and you give and you give, and you don't always hear back the positives about what you've done for a child's life. And same thing with providers. You treat patients, you see patients in their most critical times of their life, but you don't always get that feedback that says, good job, you know, everything, but if you do something wrong, you're slashed. Where in this system, these individuals are very highly educated individuals, and they have a deep appreciation for what the school system has done for them, so they give it back. It's nothing, like Jennifer said, to get emails, and people will stand up at school board meetings or, you know, administration conferences to say, you know, and just cry because literally their life has been saved. Something dramatic has happened, or not even dramatic. You know, a mom and a dad who have 3 kids and everybody's sick in the house. Typically when they would go to the primary care physician's office, it's $25 to $40 copay for all of them, plus going out and buying their medications.
Right.
And here, you know, we've had people say, we have cable now, we have this. Their quality of life is changing as well.
That's great. Mick, let's turn to you. You took over the position of HR director a year ago, but you've been in the school system for how long?
Oh, about probably 14, 15 years.
14 to 15 years. And so now as director of HR, what's your perspective on the way things used to be to now the way that you've handled? Do you think it's made your job easier as HR not to have to worry about the healthcare proponent, or?
Most definitely. You know, I'm kind of enjoying the benefits that are already laid out of the clinic and Wellness for Life. And Jennifer obviously does an outstanding job, and Mr. Ward working together and working with Christie prior to my coming into to the picture. They did a great job putting this clinic together, and the clinic itself is, you know, I enjoyed it, the benefits of it from it as an employee, and now I'm still enjoying those benefits, but also as someone who's in my position. Jennifer mentioned some complaints, and you know, the 5 complaints over what a 3-year period, and it's really nothing out of the ordinary, nothing where it was life-threatening. Everything was it was just a very, as far as I'm concerned, they were kind of minor complaints. That's the neat thing about working with Christie and Dr. Patel. You know, if there is a concern or a complaint, it's dealt with quickly, and I think people are satisfied once it's been dealt with and taken care of. And I just think the things that every time I make contact with them, they're so generous. They're willing to go above and beyond. I couldn't see. It's just a great thing for our corporation, and I really would encourage any HR director to go this direction, because I'm telling you, it's going to make your life a whole lot simpler in an area that's becoming more and more complicated.
As far as hiring people, has this been now a tool that you use to recruit people, or what kind of turnover does a school corporation have, and what kind of competition do you have for good teachers that this would be a benefit to them that they didn't have somewhere else?
Well, I think our insurance plan alone, our turnover isn't tremendously great. We have people who stay in the area for, till they retire, and then obviously there are those cases where they move or their spouse moves or something. I think the benefits alone, we have good benefits in our corporation, but prior to, we had just good, solid health benefits. Now you add the clinic to that, yes, I think it is a great recruiting tool. I think it's a perk that some corporations do not have. I think they enjoy them, and if they do have, I don't know if it's to this level, to be honest. I have talked with other people, other HR directors, and I think what they have in place is very good, but I'd put ours up against anyone's, anywhere, anytime.
Jennifer, in part of the arena now of healthcare, everybody is talking about biometric screenings and basic, let's meet a standard so that we can meet deductions for our benefits plans. I hear that buzzword all around where I'm from. We need a wellness program. So when you say wellness for life to you, help people understand out there the difference between just basic, I'm getting a screening to maybe give information whether I'm healthy, not healthy, versus long-term care that you get from Wellness for Life, if you understand my question.
Sure. We're in a unique situation because of collective bargaining, we can't require everyone to have screening. That would have to be something that would be negotiated. So I think what the wellness component is for us is the one-on-one. We have 85% utilization here, and so a lot of our employees are being seen. And the screening that's being done is all basically one-on-one. We do have screening for our administrators when we come back to school, but it's all voluntary.
So it's one-on-one, and you've got an 85% rate of the employees voluntarily coming in.
Mm-hmm.
So I know systems where they have a mandatory rate, mandatory screenings, and they don't even have 85%. So tell us, either one, just dive in and tell us why you've been able to achieve 85%.
I think it's the extra 10% that is doing the job. It's the fact that people can call and they can be seen, and they'll meet them here at the facility to avoid a ER visit if they need to. Just to call and ask a question. I mean, if it's in the middle of the night and they have a concern, and the fact that the follow-up, it's not just on the employee calling the center and wanting to get information, it's also the providers here, Dr. Patel, Ken Massey, they call the employees, they're following up with them. They're making sure that they get that test. They're making sure that they're taking that prescription. So it's the communication both ways. I think that is making that a success.
I also believe it's the professionalism of the staff. It's the extreme confidentiality, and never a concern that things are always done correctly. And it's when you walk into that front door, you're greeted with a smile. It's not, you're just not another person, not another number. They know I guess the customers is the best word for it, instead of patients, because they know who you are and you're treated like a real person, and that they care about you.
One of the neatest compliments I've heard through this system in the last 3 years, we were at one of your back to school rallies, and a janitor came through, and he came through and he said, the neatest feeling for me is that one day he had came to the clinic, and Danny, the superintendent, was here as a patient, also sitting in the waiting room with the janitor. And he said, the staff treated me the exact same as they treated this executive officer in his mind of the corporation. And he said, that meant more to me than most people probably realize. And I thought, I didn't really think about it that way. So the environment, you're right, it is very much, because we've had some people say, oh, well, Danny can brag about it, or Mick or Jennifer, these people, because they get the concierge service. And we said, no, truly, you go to the cafeteria workers, you go to the janitors, you go to the bus drivers, you go to any of the school groups, or the groups that represent the school corporation, they're going to tell you they receive concierge medicine.
That's a good point, because right before you mentioned concierge, I was thinking in my mind, someone at an executive level would expect to be treated differently, and maybe even so that, you got another contract you got to negotiate, so we better treat that guy real well, because if we don't, his first-hand experience is going to negate us from even competing. So what you just said, where the janitor feels like he's getting treated like it's concierge medicine. Now, for people that don't know what concierge medicine is, there's a whole new movement across the United States, basically, where people pay a doctor to take care of them and be available 24/7. I call it old-fashioned medicine. Even
Going back to Mayberry.
And where the doctor will answer the phone at 2 o'clock in the morning. Have you either had experience with your employees talking to you about how their families, let's go beyond the employee himself, how their families have been treated? Have you had any, testimonies to that at all, rather than just the employee themselves?
Oh, go ahead, Jennifer.
Oh, yes, I mean, that's all the time too. We have a person that is on the benefits committee with us, and she has twin girls and a son, and they're all under the age of 8, and she's constantly talking about, just the little things that come up with them, and having the ability that she knows she could call Dr. Patel and ask him about it. And she said she just values that because she's busy in her position, and she needs the times that are, after school, the unusual times, and that's where the availability is with Dr. Patel.
Great.
So she's, I guess, non-traditional would be the word that I would use, and he's available to her, and she's had to call him on weekends, and she really appreciates that, because they're active and they're at school and they're getting sick and they've had their issues, so she's always brings that up at our meetings.
Great.
And typically for families, we are busy, we're running through the week, well then it's that Saturday morning when everybody wakes up not feeling well, and then, as the mom, you're finally reconnecting here, and you have the weekend, and that's when our patients need somebody. We have Saturday hours here because we want them, and then, of course, to that next level is access. We want them to have access to their provider, because it's sad to me sometimes when I have watched, just being in the ER world, we'll have patients come in that on Friday they saw their provider, they gave them a medication, they had an allergic reaction or whatever. So now the ER is starting a course of treatment that truly may not be exactly what the provider had intended for this to be. Then you're setting the patient back. So having that access to call with any question, and everybody always asks too, they say, is this abused? And I said, it's never abused, it's utilized. But it's utilized for the right purpose. People don't abuse it. They don't just call us up and say, hey, the weather's hot, and I'm having a sweat, and maybe it's a hot flash. Talk about, my boyfriend left me. It's nothing like that. It's truly concerns, health concerns. So it is utilized but never abused.
Well, I think that everybody, no matter in today's society, no matter what walk of life you're in, whether you're a teacher or you are a custodian, or you are the groundskeeper of the ball fields or whatever, everybody is under such time pressure that I think a big part of medicine has gotten rigid over the years, and you have to fit their schedule. I've experienced that. And so to have a model where they fit your schedule has to take a burden off of people's shoulders to be able to say, I'm not feeling well today, but I don't have to leave work. I can go on the computer, make an appointment, or call in, make an appointment, Am I getting this
Correct.
correct?
Mm-hmm.
And then I can go after work hours, or I can go Saturday,
Right.
that type of thing. But tell me more, a little bit more, and we'll wrap this up with a couple more questions. Tell me about the impact it's had on your community from a taxpayer perspective. Has there been interaction at the school board meetings? Has there been awareness of the community that the school corporation's saving money? Talk about that perspective.
Well, I want to go back a little bit and then I'll get into that. But it's a one size fits all, but it's a very, very comfortable fit.
Mm-hmm.
When you bring some of your kids, your younger kids in here, younger children, I see a lot of them sitting out in the waiting area and not for very long, obviously. So it is when you go back to meeting all employees' needs, this clinic definitely does that. And when it talks about the taxpayers and saving money, most certainly, it is a cost savings to everyone, particularly when there's no copay and things like that. I think that obviously is a cost savings, and then the medication. But there's a lot of things that go on when they bring their kids in, and they are probably our employees are probably our best advertisers.
Mm-hmm.
And they're out there telling that this is or employees, I'm sorry, they're saying that this is a good thing. It's working for them. It's working for our community. I think there's it's not. We still encourage them if they need to go to their specialist. That's fine. Do that. But I see people doing both. They're going to their specialist, also coming here. So, like I said, it's just been a nice marriage, I think, for our community also.
Very good. Let's just close out with this. I get a little bit of demographic of the school system. Okay. How many employees do you have, and from what ends of the spectrum are they? Let me put it this way. There are, I understand, like 1,500 employees or so here, or how many?
Probably 1,900.
18 or 1,900. And of that 18 or 1,900, how many are on the plan that allows them to utilize the clinic?
Just over 1,100.
Just over 1,100. Okay.
That's employees.
That's employees. And then with family,
It's about 2,200.
it's about 2,200. So this isn't Mayberry. This isn't a 500-member town. And you're talking about the personalized service that you're receiving
Right.
with 2,200 potential patients, customers. So that's pretty impressive. To have five, I don't like to focus on complaints, but we're trying to be honest with the world out there and say to have 5 complaints
Over 3 years.
over 3 years with 2,200 potential employees and their families is pretty incredible. What is the makeup of, in proximity to the county where the employees live? Are the majority of them live in the county, or do a lot of them live outside the county and commute here, or as far as convenient location to where people live?
I would say majority of our employees live within
the county. And I understand, Christie, that when you locate the facility and wellness center, that you actually look at the demographics of population, need, and all of that, and say, okay, this is the center of that universe.
We typically take the zip codes of all the employees because literally, we want to put the clinic in the area that, for the distance around the travel. But what's very, very neat about the school corporation is this facility here. It's not really, it's the north end, kind of labeled, maybe North High School's down the road, but at the same time, it's within a 10 to 15 minute driving distance from pretty much every facility in this area.
Okay.
And the majority of the individuals, the neat thing too, and I just will spend a minute giving some bragging to Vigo County School Corporation, which I have been a part of. My children, of course, I have 2 graduated from here, 1 in high school. But the really neat thing, the teachers who are a part of the school corporation are part of the community. They literally do live within a very short radius of this center, but also just in the community. And what's interesting too, Danny Tanous literally set a bar high, not for his own level of concierge, so to speak, but he's the type of leader over, and because of that, you have Mick and Jennifer who have the same heart towards the employees to say they deserve the best. You know, it's expected to give Danny the best, or these guys the best, but Danny would set the bar higher to say give them better. You know, I want my employees taken care of. And so in doing that, even if a patient or an employee lives in Sullivan County, or Brazil, which is a good 25-minute drive, they will still drive to the clinic, because everything that comes out of this clinic is so positive for their overall health care. And what is, for me, my heart is the patient. I love when I see patients take accountability for their own health. You know, a lot of times people play hard and they'll open up we search for the best cell phone carrier, who's gonna give us the best rate. But a lot of times when you're looking for your provider, you just open a phone book and just point a finger and whoever can get you in the shortest amount of time. So what this facility has done for patients as a whole is put the accountability of their health care back in their hands instead of in the system's hands. It's in their hands. And so we as a team, we put the right providers and nurses and office staff in here to help encourage that possession that they take of their own health care. As Jennifer and Mick shared, Ken Massey, who is the lead provider here, PA, at this facility, instead of having the nurse call the patients back with lab results or, medication changes, he calls them up himself. So the entire thing is just a very win-win, as Jennifer said, for everyone. But as far as the demographics and the dynamics of where this clinic is located, it could probably be 45 minutes down the road and the patients would still drive.
Well, I know in rural areas, some people have to travel a couple of hours to get good care because there just isn't enough population for a doctor to set up practice or what have you. So to have this in a center like Terre Haute, it has to be a big plus for people. 25 minutes, I would travel 25 minutes to go to a doctor with no problem at all. So that is a great perspective. What I want to bring across is, if you're speaking to people around the state or around the region or even across the country, you've explained that you potentially have a couple of thousand people that could utilize this, yet they're getting ultimate care, personalized care. You've explained to me that you feel like you're the only patient they have when you come to the facility, basically, and it sounds like together as a team, the school corporation and Wellness for Life have just worked together to create a model that others should take a good look at. So I don't know how to shoot down anything you've said, because we've all experienced healthcare over our lives, and the longer you live, probably the more experience you get with it. And so if you've got an employee who's been here a long time, and maybe not because there's bad providers, but maybe because there were other barriers like co-pays, chronic illnesses where people have to buy medicine. And I'm not saying that Vigo County, because I have no idea what the pay scale is here, but people do teaching as a vocation more than they do it to get rich. Would you agree?
I agree with that.
So in that context, an added plus for somebody who's giving of themselves in a vocation is to provide them with good quality care. That was always the promise that public entities made to its employees, was we'll give you health care, and you're not going to make a lot of money. And so I see that here in Vigo County, but the thing that I've seen as I've done these interviews is that people are almost like happy to work here. That's
Absolutely.
and they're happy for the care they're getting. So in the end, you're saving money, but in the beginning, as the people who represent healthcare for the county, in the beginning, did you have to cross a hurdle and say, we're going to have to pay more before we can save money? Or did you see the savings in it from the very beginning? I mean, you talked about it as an added benefit, but it's become their main source of healthcare. In that transition, was there we have to invest in order to see savings, or?
I think you might have looked at it as an investment in the employee's health, but on putting a monetary price tag on it, I don't think we looked at it like that. I think that we looked at a way, instead of shifting cost, this was one way that we're going to begin the process of not shifting cost and saving. So I don't think that we looked at it on a dollar tag that way, but we certainly did look at it as an investment going forward, as an add-on for our employees.
Okay, and so, and what I'm driving at is that other people look at it, say, well, gee, I've got to make this huge investment, budgets are tight, what is my return on the investment? So from a HR director standpoint, and you have a boss, and your boss has a board, how was that sold to the board to say, we've got to invest in a clinic, but we're still good stewards of the taxpayers' dollar, and then we're going to have a return on investment? How did you have that vision of things to be 3 years later that I understand is in the millions of dollars?
It is. It is. Well, I don't know.
No, you go right ahead if you. I think when it comes to, that's a good question. It's kind of a difficult one to answer, but I think when it comes to the hurdles that we had to go over, obviously I wasn't in this position at the time, but I was at the board meetings, and I think if I would just recommend that everyone just do their homework thoroughly. If this is a direction you want to go, because there will be some resistance, and I think even now there's some resistance, because that's just human nature. But I also believe that more and more, as you look at the number of people that we're serving, I don't believe it's. I think it's helped them, and our main goal is, yes, we care about the community at large, obviously, and we care about making sure the other healthcare people, providers are making money. That's important also because it helps our community. But our number one concern was our employees, and I think what was best for them at this particular, then let them make the choice.
Very good. Do you have anything you want to close with, Christine?
Again, as Jennifer started the interview saying, it's a win-win, truly. And the heart of our company is not only delivering concierge medicine to the patient, but also to the client. And that's where that communication is very vital. And I believe the success of this entity, this clinic, has been because of those components. And truly having the administration who has a deep, strong heart for their employees, that's really all it took.
Right.
Definitely.
Anything you'd like to add?
Well, I think one very important endorsement that we didn't discuss was Anthem. Anthem is our carrier, and we had a spotlight where we wanted to show the taxpayers, we wanted to show the board testimonials of how the clinic's going, and we actually had our Anthem rep get up and state in front of everybody that this clinic is the model. She works with lots of schools in the state of Indiana, and this is the best. So for her to be able to stand up and say that in public, because I didn't think she would be able to, because it would be an endorsement and she said, no, I absolutely will.
And we have no alliance with any insurance carrier, because all of our clients have different insurance carriers, so we don't align ourselves, so we didn't prep her or even realize.
So tell me, what is Anthem's role in all of this? Because you just brought them into the conversation. Do they just provide you with health insurance, or they manage? Because you're self-insured, are you not?
Yes, we're a cost plus. It's a kind of a complicated thing. They still do. We accept some of the claims liability over a certain amount, but they're still our ASO. They process the claim, they process these $0 claims that come through. So they have all claims data and they do all of that. And then we have an Anthem rep that comes to every meeting that reports on different things going on with our own specific population, plus things that they're doing at Anthem. We have reports that we go over as far as our claims running high according to premium, and that's kind of the interaction we have with her.
Right.
Well, when we see negative numbers where our claims are coming in at less, and not only less than trend, they're coming in, in negative numbers, she automatically says, it's because of your health and wellness center.
Right.
She's like, there's no doubt. There's no doubt your generics are running this low. There's no doubt, your office copays. It is because
So
of
they're
this
doing the
place.
metrics on,
Correct.
and they're comparing from where you were before to where you are now,
Yes,
and they're providing that at public hearings.
they did. Upon our request, they did.
Great. Anything you'd like to add?
I'd have to say that Wellness for Life, the clinic, and what Dr. Patel and Christie do, it's all forward thinking. There's no status quo. It's just how can we continue to get better, and how can we continue to improve the health of our patients. So that's probably, to me, that kind of sums it all up. They're just not they're not happy with where they're at.
No.
And,
We always want the next.
and we're really happy, don't get me wrong, but and we thought, gosh, we didn't know there could be more, and there is more, and they seem to always come up with something more, and that's what's so impressive about being a partner with them.
And sometimes Dr. Patel is such a visionary. I have to put a cap on his mouth for a little while. I'm like, these people aren't ready for that yet. Just hold on. But that too, Ed, when you talk about what sets us apart from the other, companies out there with similar models, we are physician founded. So every piece that goes into our clinics is patient centered. Where a lot of companies, on-site companies, a lot of our competitors are founded by brokers or MBAs, business people, which there's nothing wrong with them. It takes people like me and them to help do all the processes in the background. But when it truly comes to building a clinic model that is patient-centered, it takes a physician, it takes a medical provider of some capacity to make that as successful. And that's Dr. Patel. His visions aren't how can we make more money, or it's always about how can we give more to the patient? What more can we
Provide
do
better
for
service.
Exactly. And I think that truly sums it up to the heart of who we are.